No place or person that I would recommend more highly than Millennium Medical and Dr. Deuk and his team. As far as the insurance goes, I mean, of course, when you get a major procedure, you get very nervous about, co-pays, deductibles, all the things, because the cost of medical insurance continues to go up and up and up. Dr. Deuk has a couple of individuals, I would say, I think they're in his finance office, that I spoke to before the operation. And before each procedure that I've had, they've kind of outlined for me, okay, your insurance, they're part of, Cigna, so they cover that portion of it. The operating room, I believe, was outside the insurance, but they worked it out for me beforehand so that I knew the total cost out of my pocket before I ever walked into any procedure, whether it was an injection or the operation itself. I have to say that they've held true to their word, even though some of the costs may have come in over or whatever. Whatever I've paid that I agreed to up front is all that I've paid. I have not paid a dime extra. So I've been very happy with all of that. It's been very good. Today, I will tell you, after the operation, I only took the pain medication for about the first week after the operation. For the second week, I took probably 3 or 4 days of Tylenol, and since then, I haven't taken anything. So, in terms of managing, pain with medications, I really don't believe in all of that.
In terms of being hereditary, Dr. Deuk did mention that Greg's spine is like mine. It's a very narrow spine, which probably indicates that we're more prone to back problems with that, I would imagine,
And even the smallest of problems in our back probably present themselves a whole lot worse than someone who has a normal spine. The way Dr. Deuk explained it to me was, he said, if your bone structure is this thick, he said, your spinal canal should be about the same thickness. He says, you've got about half that amount of space. He said, so if, you do get a herniation, he says, even if it's a small one, he says, that herniation may cause you more problems and pain and discomfort than the normal person. So, from a hereditary perspective, I have my father's spine. So I'm hoping that as we go forward here, that Dr. Deuk and his team will be able to help me throughout my life. Dr. Deuk does a whole lot more than just neurosurgery. He's kind of a one-stop shop for every expertise. And, when you go other places, you find that all they do is deal with maybe from a chiropractic point of view or from an injection point of view. But when you see Dr. Deuk, the thing that impressed me was, he wasn't one of these people that, I walked in and because he's a neurosurgeon, he finds a problem and just wants to operate on you. He wanted to look at me and say, okay, what's the least invasive thing that we can do? He started with doing injections, okay, and a rhizotomy treatment where they go in and kind of burn the sensory nerve endings. Unfortunately, it didn't work for me, but I was happy that they were taking that kind of approach first, because had that worked, then the operation wouldn't have been necessary. And when you look around his office and you look at all the different disciplines that they have in there, from Dr. Patel and others that are in that office, you realize that they're trying to do the least invasive thing. They're trying to get you back to your normal life in the easiest way possible. Now, in our case, it happened to be neurosurgery with replacing a couple discs and all of that. If that's the direction that you have to go in, there's no place or person that I would recommend more highly than Millennium Medical and Dr. Deuk and his team.